ఒక దాంట్లో రిజిస్ట్రేషన్ చేసి సర్టిఫికేట్ వస్తుంది లాగిన్.
participate आवाज क्यों आ रही है?
Join के इसका माइक खुला है, बोलिए टेबल बन के आया है, माइक बंद करो।
What an anime.
Hello, ma'am. Ashwini, ma'am. You can't. Okay, I'll ask you first.
Yeah. Hello, good
Yeah.
evening, ma'am.
Good
Yeah.
evening. Am I audible, ma'am?
Yeah, you're audible, ma'am. Actually, Sine ma'am has asked me to share my screen, but I
Yeah, yeah.
think you have to allow me to share my
You
screen.
want okay, okay, okay. I'll check that, ma'am. Thank you.
Sure.
Okay, thank you. You can switch off the camera. It's okay. Now you can.
Yeah.
We'll later.
Sure, ma'am. Sure. Thank you.
Ashwini, ma'am. Can you please share the screen? Okay. The screen is visible, ma'am.
Okay, ma'am.
Okay. Thank you. Thank you, ma'am.
Yeah. Thank you. Can I stop sharing or you want me to?
You can stop sharing. We'll do it.
Yeah, ma'am. Sure.
Ajit sir, can you please unmute
Yeah,
video also? Is it audible, sir?
yes, you're audible,
Oh.
Tanya.
Vinny sir, am I audible to you?
Yes, can you hear me?
Yes, sir. Can you please? Yeah. Thank you, sir. It's visible and audible. Can you please share the screen so that we can see that? Check that, sir. The
Right?
screen is visible, sir.
Yes.
Okay, thank you. Thank you, sir. You can switch off the screen sharing. Later, we will switch on it. Yeah, thank you. Thank you, sir.
Good evening, everyone. I'm really thrilled to have you all on this platform. We are going to have a free webinar on leadership and communication skills for the future nurses. So people are joining. Am I audible to you all? Anybody can confirm whether I'm audible?
Yes, yes, sir. You are audible.
Yeah, thanks a lot. Thanks a lot. Welcome everyone. We have a lot of people are joining from around every part of our country. We have people from. Can you just the people who have joined? Can you just write down your which state you have joined from in the chat box so that we can understand you which all the states you are joining from. We have people from around the country. I mean, from all over the country. We have, I think, mostly all of you might be working professionals or the students who are already studying nursing. Tanya, can you just confirm to whom I need to hand over after the first session? I mean, the intro part. Mr. Dinesh or Dr. Dinesh or Mr. Ashwini? Yeah, okay. Great. So I hope you people are, everyone, are nurses or the students who are already studying the course. We are Easy Nurse team. We are here for you to support you in your journey as a nurse. We are an innovative platform which supports the nursing students all over the country to enhance your studies through the video lectures and the simulations in different manner. So we are here to have as a communication skill development program or the leadership development program today. We have two wonderful people with us, Mr. Dr. Dinesh Selvam and Mr. Ashwati Ashokan. Dr. Dinesh Selvam is the principal and professor of Amity College of Nursing, Haryana. And Mr. Ashwati Ashokan is the Chief Nursing Officer in Sharon Oncology from Bangalore. They'll be helping us to understand what all the challenges we are facing today. As I was understanding these days, the industry itself is changing all over the world after the introduction of the artificial intelligence. There are a lot of changes are coming across our country, not in the country, in the industry. And there will be changes happening all over the world, how we are approaching towards our the way of doing things, not only in the nursing profession or the medical profession, but also in every industry. There are a lot of changes are coming across. So, but one of the industries or one of the jobs we understand, which will remain constantly without much changes. There will be definitely some changes coming across the job roles and how we are doing the jobs these days. In couple of years or after 5 years, the way we are doing these jobs will be definitely changing, seeing a lot of dramatic changes in the way of doing things. But especially in nursing, when it comes to our profession, there will be limited changes happening. But we need to understand what all the challenges we are going to face and what all the changes we need to face in coming years as you are coming out of your colleges, or when you are searching for a job, or when you are entering a job, in a job. You need to understand how to tackle the challenges you are going to face, and how to be in the leadership roles. That's for that it's very important to have the communication skill and the leadership skill as a person. So this is a part of personal improvement and helping you to get into the leadership positions when you are coming to a job profile. So as I told you, we have Dr. Dinesh Selvam with us, who will be helping us to understand the leadership roles and the challenges we are facing all these days. And Mr. Dinesh, after his MSc in nursing, has completed his PhD also. So he will be he's coming with a lot of information and knowledge and understanding about the profession we are having. So I would like to hand over to Mr. Dr. Dinesh Selvam. Dr. Dinesh, welcome to the program. Over to you, sir.
Good evening to everyone, and thank you, Mr. Rajesh, for a short introduction. And I am very overwhelmed to see there are a lot of participants from all over the nation. So nice to see you all, and to see your interest to spare around 1 hour to attend this wonderful webinar, which is organized by AZ Nurse, who are now, they are coming out with a lot of solutions in nursing education. Very appreciable, and the work what they do in the field of nursing education. See, the topic to go, I think this webinar focuses mostly on leadership and communication, right? So this participants who are over here, I can see they are all of mostly student nurses, and who are just going to enter into their practice after their course. And I think most of them are there, and there are other people who are already working in the clinical area, and I can see that. And I can also see the teaching faculty, some of the associate professors, assistant professors, and other people have joined this particular webinar. So welcome you all, and thank you for the AZ Nurse for giving me this wonderful opportunity to talk on leadership for future nurses. So may I know how many of you want to become really a leader? Have you ever thought of becoming a leader in nursing in your area, wherever you are going to work? You can just raise your hands, I think. There is an option. If you raise your hands, we can know. Yeah, so leadership is, everyone will actually strive to be a leader at any sense once after a quiet time or long period of working. And if you see here, what is leadership? What is leadership? Leadership is the practice where you have to guide, you have to inspire, and you have to influence the nurses and other healthcare professionals. Why you want to lead them and bring a change and influence them is you want to attain or work towards a common goal, that is to attain a good quality patient care. And wherever organizations you are working, you have to work for the organizational objective. So this leadership is really a practice. You can see there are a lot of explanations can be given as a leader, and also you may have certain people in your mind when you want to be become a leader, and you would have seen certain leaders in your experience while studying or while working. You would have been influenced by certain leaders, and you will strive to become like them. So when you say a nurse leader, it's a very serious business. Okay, it's not a business which you can come at a fluke and just take care of it. No. See, when you want to become a leader, or a leader and a nurse is highly committed because they want to deliver high levels of patient care. And a leader, as the definition says, you want to influence the workers or the influence your own colleagues to accept you as a leader. Not only that, as a team, you have to manage the entire team and communicate among the team to attain the goals in time. And you have to achieve the organizational goal or the task which you are going to work. So it is goal oriented, it is very much focused, it is task oriented, it is something which you want to manage among the entire team. It is something where you are working towards the attaining a high level of patient care. Is it not very serious job? Yes. So a nursing leadership, it refers to anyone who is going to positively influence other nurses so that you are going to healthcare organization and manage the entire team. This is what American Nurses Association say about leadership. When we go in depth, there are certain aspects which you should know in the leadership. A leader, as you say, as you think of anyone as a leader, the first or some key aspects which comes out of leaders should be, one is influence and motivation. They should influence you. How they will influence you? Maybe through their character, through their quality, and through their work efficiency. Not only that, they motivate the colleagues. They motivate the colleagues. They motivate the entire team to work towards the organizational goal. And they set the vision. That's what we were telling about the attaining the organizational goal. A leader will focus on the future. They work on a vision. The vision mostly will be focused on attaining it. And they always work excellent, they drive excellent means whatever they do, there will be an excellence in that. Effectiveness will be there on the work, what they do. They advocate for the problems, they raise voice for the right way, and they also empower the nurses or the colleagues who they are going to work along with. And communication and collaboration is another important aspect when we talk about the leadership. And that's why the main topic here focuses on leadership and communication, where communication is going to be taken by Ms. Ashwati, who is going to follow this particular presentation. And decision making. So there is a critical situation, or there is a particular situation where the nurse leader has to take a decision. So the decision what you take will lead to the attainment of the goal. And of course, as a leader, you have to develop the profession also. So this is what is expected from a leader. When you say a leader, this is what generally the aspects of a leadership. Right. Now, why we want this nursing leadership, or why do you need a nursing leader? Nursing is a part of healthcare system. You know how the nursing system is very important nowadays. And nursing system or a nursing care is the heart of healthcare delivery system, which everyone is going to accept. So a nurse, without a nurse, the healthcare delivery system is not going to function. In the case, a leader who is going to represent, say, a nurse leader, so they have to be very important in the profession to lead or to improve patient outcome. That is what we are focused, the nurses are focused. And a staff morale. They are going to create an enhanced staff morale. Can you all listen and see the slides? And they are going to address the nursing shortage, and they are going to drive the change in the innovation. So innovation in the sense, they are going to come out with the new solutions in the practical area when they are going
Hello,
to
sir. Hello, sir. Sorry to
Yeah.
disturb. Sir, can you please switch off the sharing option again, and can you share it again, because the students are annotating in the screen. It's getting disturbance, right? Sorry, sir, for the inconvenience.
Okay.
We are working on that. Sorry, sir.
Yeah. Can you see now?
Yes, it's visible, sir.
Okay, that's how why we say this nursing leadership is very important, especially when you are in the healthcare industry. You have to bring the change in the healthcare industry by, the promoting the health and by bringing the improved patient outcome. Right. Seeing this as an importance, as you all are the student nurses, maybe you should know what are the nursing leadership hierarchy. We are having it in the system. See, if you see, generally we say the top level or the bottom level, you can see we call them as a charge nurses. So as of now, we call them as a nursing officers, and they are being supervised, or the next level will be the nurse managers, and above them will be the nurse administrators, and above them will be the nurse executives. So the nurses who are just attending this webinar should know this hierarchy. Okay, so you maybe now as a nurse manager and you wish to become administrator and wish to become an executive, or a charge nurse wants to go to the next level of becoming a manager. So this is how the system works. If you can go to my next slide, you can see the thing which is available in India, the hierarchy. As of now, we call every nurses who join in the area, in the clinical area, we call them as a nursing officers. You know that. So then they become a senior nursing officer.
It is in meeting time. Inside meeting time, sir. Meeting time, sir.
Hello? Am I on the thing or? Okay, then the nursing officers become a senior nursing officer, and then they are supervised by the nursing superintendents, you can say. and assistant nursing superintendent and deputy nursing superintendents, and you get this nursing superintendents. Now you call them as a chief nursing officer. So these are the hierarchies or cadres you can see in leadership when you go as a nurse into the healthcare industry, right?
Hello, sir.
Yeah. Am I there?
No,
Am I?
sorry, sir. The screen,
Yeah.
students are interrupting that. So 2 minutes, can you please hold it? We are working on that, sir.
Yeah. By the time I will keep talking to them.
Sure, sure. Thank you, sir. Thank you so much.
So when you want to become administrator, I think I have told about, without the slide, I'm just telling you, I have told about the various hierarchies which is there in India. Most of the student nurses over here will aspire to become a leader. So you become a nursing officer and then you move to the senior nursing officer and assistant nursing superintendent or a deputy DNS, you say, then you become a CNO, which is the nursing superintendent cadre. So this is what the hierarchy which is available when you take in the clinical area, right? So, leadership comes with situations. So how you, present yourself in different situations. You just think an example, I will say, okay, you are there in a ward, you take it as an emergency ward or the casualty. Okay, it's heavily raining and the ward medical officer, the casualty medical officer has not yet come into the casualty. He has been struck with the heavy rain, and you receive a patient now, a patient or a victim who was met with an accident. It comes as a patient to the casualty area. So you are there, and with you there are another two nursing officers or the nurses with you, and you have other cadre workers in the ward. So now at this situation, there is no medical officer, and you as a nurse in the unit. So how you are going to take care, isn't it? So what you will do here, based on the situation, you take the leadership role, isn't it? So you ask your colleague, one of them, to examine the injury, what has been happened to the patient. The other person, you will ask them to get ready with the IV drips, and the other person, you will be asking them to check the vitals and monitor the blood pressure or monitor the airway, depending upon the severity of the case. At the same time, you will be communicating. You will be communicating with the medical officer. You will be receiving the orders, and you will be doing it according. So automatically, you have taken the leadership role. So in this situation, right, you are, by the time the doctor arrives, so you have made the patient to be stable, and the doctor arrives and he takes care where the patient is now stable and he has crossed the danger, isn't it? So this particular situation, as a nurse, you have taken in charge, and you have dealt with this. This is how you exhibit the quality which is within you. The nurses who are already prepared from the curriculum, I mean, they are already prepared with good, this kind of leadership exercises. But still, this leadership depends upon certain qualities, okay, or it depends upon some competencies which is usually required for the nurses to become a leader. So when you say the first thing, what I will say, or a first competence or a first skill, what I will say, to attain, yes, the communication. So communication is very basic, very basic, where you have to attain the communication skills from the beginning, and you will develop more communication skills which will lead to how to manage the patient attender in a healthcare scenario. And then how you
Sir?
maintain the communication with your own colleagues, how you maintain the communication with your own next level boss. So
Hello,
this
sir.
communication is, yes.
Sir, the annotation we have disabled that. Can you share the screen again, sir?
Yeah, one minute. So this is the first competency which I will advocate for the nurses. Then we can talk about the professionalism, efficacy. Okay, see, ethics. Professionalism is very important. I am just sharing the slide. Are my slides visible? Yes.
Yes, sir. Yes, sir.
Okay. Now, professionalism is other thing where you talk about how you put yourself in front of the healthcare delivery system. See, as a nurses, you put yourself with all professional quality. So, which automatically will influence others to follow your quality or to follow your behavior and ethics, doing the right thing when it is necessary, advocacy, where you are going to talk, about, or you are going to advocate for your clients, or you are going to talk about the rights of your patients so that they are getting the what to say, that the care what they are going to get, right? Now, talking about this competency, I have told about communication, I have told about leadership, I have told about professionalism, and I have told about the knowledge which you should want. And there are certain management skills. Usually, leadership goes along with the management skills, how you manage the particular organization and the activities. Yeah, next, you have already learned about the various types of leadership, and I mostly recommend the 5 types of common leadership, very common leadership, which is usually used by the nurse leaders. So you all know the democratic leadership, isn't it? So the democratic leadership is you allow your own colleagues or the employees under you to participate in all the decision making. So you want to introduce a different nursing system, or you want to develop a new unit where you are going to allocate certain nursing protocols. So you involve everyone and you take the participation of everyone, comes the democratic leadership. Transformational leadership is purely what I told regarding the inspiration. So you first act as a leader. The quality which is in you will influence others, will transform the entire. It is mostly about motivation. So being yourself as a leader, you motivate your colleagues, you motivate along, be with you to bring the required change in the healthcare delivery system or in the nursing system. You have another leadership which everyone know, that is laissez-faire, where the leader he or she will be not minding much about the employees or the subordinates or the colleagues, and they will allow them to do whatever they want and a way to solve the problem. So that is laissez-faire leadership. And one more thing which is very common, which is very peculiar in nursing leadership. I'm talking about mostly in the nursing leadership. You call it as servant leadership. Servant. So you can always servant in the sense you make your own subordinates, you make your own colleagues to be important. Okay, you want them to be happy, you work for them, and what is their problem, you come out with their problem and you try to solve it. So you would have also seen our prime minister used to use this word, isn't it? I am the servant for you all. So this is servant leadership, where you make the subordinates happiness or satisfaction to be the top priority. All right, then comes affiliative leadership. Through your affiliation, okay, you have the power, you have the position, and also the conflict. Whenever there is a conflict, you want to resolve the conflict. So based on this, you have affiliative leadership. So among doing certain reviews, we have found out this top 5 leadership to be very common leadership styles in nursing. So I repeat, since there is no slide, one is democratic and another one is transformational leadership, and you have laissez-faire leadership, you have servant leadership, and you have affiliative leadership. I know well the participants may also know the other leadership styles like autocratic, you say, and you say like situational leadership. So a leadership, I personally believe that there is no any one particular leadership. So you have to employ this all types of leadership based upon the situation and also based upon the environment and the condition. That is my own recommendation. But the servant leadership works well, and doing a review, we also come out with, I've just done a review where what different styles of leadership we're working on with the different generational employees, isn't it? So we say now, you would have heard about the terms boomers, Generation X, Generation Y, or millennials. Have you all heard? And now the Generation Z, you say Gen Zs, isn't it? So you would have heard all this. So when just doing a review, I just saw that leadership, autocratic leadership was very famous. Not only famous, it really worked on the people who you call it as boomers, that is the employees who were between 1948 to 1964. And when you see this Generation X, 1965 to 1980, whoever were there between 1965 to 1980 born, no, you call them as Generation X. For them, the leadership which worked on well was servant leadership. Then the millennials were 1981 to 2000. So we all, most of them will come under that, where they are found to be a lot of independence. They want independent, and many of the times the leadership which work for them is laissez-faire. And Gen Zs, we say Generation Z, who are born after 2001, they prefer coaching leadership. They want someone to always coach them. This generation, they want a coaching leadership. This is what I found out in review. It's not my point. I just found out in review. And okay, you as a nurses, you want to become a leader? How you want to show? How you want to show your leadership, isn't it? You want to show your leadership? How you can show it? One, I will tell you, experience. Okay, so you go join as a nursing officer. You work with different cases. You deal with different patients, and your own experience will show your leadership skill. Then comes education, isn't it? You need, of course, you need advanced education, where it may be a postgraduate or it may be any additional education which is going to talk about the leadership skills and management. And other important next thing, when you want to show your leadership, what else you want? Critical thinking. Okay, what is this critical thinking? Critical thinking is your ability to think wisely and to take the decision in any kind of situation. So how you can apply your critical thinking is mostly when you are having a knowledge and when you are having experience, and you can put that as a evidence in your practice, and you can take a better decision. And of course, you want to show your leadership, you should have a passion in nursing, isn't it? So you want to be a nurse, you should show that passion towards nursing, towards caring, towards leading, towards working as a team to bring change in the healthcare delivery, in the nursing care delivery. When you have this passion, you can show up your leadership. And of course, the ability to inspire and motivate, isn't it? The ability to inspire others and motivate others is another important quality where you can show your leadership. Then, as of now, you need technology. So you need a knowledge in technology. You need a proficiency in technology, where right now AI influence is there even in the nursing care, and bringing out, managing the nursing care in a unit and everything. There is AI influence. What do you call it as nursing informatics? So technology proficiency is also needed for today's students to show their leadership quality. Then the is not the last one. I want to stress it is the communication skill. So communication skill is very important. How much to communicate, when to communicate, isn't it? And what you should keep in mind when you are communicating. So communication is the another thing which you need. So I just repeat, when you want to show your leadership, okay, how you can show? One, you need experience. Second, you need advanced education. You need critical thinking skill. You need passion for nursing. And you should have the ability to motivate others, inspire others. And you should have the good knowledge and skill in technology. And among all, you should have a good communication. Right? And apart from this, I want to say another three important quality a leader should have. Maybe the leader should be demonstrating humility, that is humbleness, and should have a vision, and they should act as a mentor. Okay, mentor means guiding, coaching, and giving suggestions whenever the juniors or the colleagues require. Integrity. See, integrity is very important. This integrity aspect is something about honest, isn't it? Honestly, uh, demonstrating your the quality of truthness and honest among your colleagues and in your work. This integrity is very important to accept anyone as a leader. Of course, collaborative. So you have to collaborate with everyone. Nursing needs this collaboration, the inter collaboration and the interdisciplinary, which works well. Then you have time management, problem solving skills, and emotional intelligence, which is very much essential to deal with any kind of emotions. You all know, understanding the nursing working system, isn't it? The long hours and the pressure the nurses face. So, as a leader, you should have this emotional intelligence. You should develop in order to tackle with the patient and tackle with the medical officers and other interdisciplinary people when you are collaborating the healthcare giving. Right now, time management is other important quality, and of course, flexibility. So I am just putting all these bundles together so that you can understand about how much is the leadership is important. You already have this quality, you can work on it, or you can start achieving these qualities by doing simple exercises. So leadership, I tell you, is a very important thing which will inspire and motivate others. And to become an especially a special leader, you should build that foundation, and you should create that particular passion and the goals, and put out all the negativity, improve your communication, okay, and act like you inspire, act by your own behavior, by your own manners. You put yourself as inspiring, as motivating others. So this is what essential for becoming a nurse leader. And with this, I think I just stop here. And as I already told, leadership, you need basic thing is communication, which is going to be the next session. You want to take questions at the last of the session or anything up to the organizers?
Yeah, yes,
Yes,
sir.
Adish, yes.
Yeah, we have people. If we can take the questions right now also. I think if your session has been completed, then we can take session. I mean, questions from the participants. Then we can move on.
Yeah.
Participants, if you have any questions to ask about the leadership, so I was talking about the leadership and different leadership styles we can apply in our workplaces as well as in our profession. That's what sir was telling about. We have people from multiple states of our country. We have people from Kerala, Tamil Nadu, Karnataka, and Assam, Maharashtra, everywhere. So if आप लोग को किसी को अगर हिंदी में भी बात करना है, मतलब लिखना है, तो भी हो सकता है, कोई प्रॉब्लम नहीं है. हम लोग उसको समझ सकते हैं. So anyone, if you want to ask any questions, you can write down it in the chat box so we can understand and ask the questions to the sir, right? I think when it comes to the leadership, I think it's decision making is very, very important. I mean, but to decide and take the decisions on right time is very, very important. And sometimes we need to know which path we need to take when we have multiple options. So that's very, very important when it comes to leadership. So taking decisions are very, very important. But when it comes to, I mean, when we go beyond that, I think what not to do, that is very, very important. That comes with the experience, as sir was telling us. Like the experience is very important when the decisions, we have to understand which all the decisions we should not take, or which all the paths we should not move on. That's very, very important, isn't it, sir?
Yeah, of course. The experience and how they face different situations when they are put into their work practice will automatically show their leadership skills.
Yes. So when the challenges comes across, we have to, I mean, when it comes to different job roles we are coming across, and we are playing different roles in a hospital, we will have to take decisions. So when we take a particular decision, it may lead us to a different situation where multiple people are getting affected with that decision. So when taking the right decision is very, very important when a critical situation comes across. That help us, I mean, that understanding comes with experience. But sometimes what I have experienced in my life is like not taking the wrong decision is very, very important. I mean, if the things are getting wrong, then it may get into a worse situation. So that is also very important. So that comes with a lot of experience. Not to take wrong decisions. It's very, very important. So I think we are not getting any questions as of now. We have more than 1,000 people attending this session from different parts of our country. So thanks a lot. We will be moving on. Sir, shall we move on to the next part of the training program?
Yeah, next you can move.
Yeah, thanks a lot. Thank you very much, Dr. Dinesh Selvam. Sir was talking about the leadership, the different methods and the principles of leadership. And we expect everyone to be a leader in the coming days of our profession. As we know that the Indian nurses are playing a very vital role in the medical industry and the medical world, and in multiple countries. There are people working around the globe from our country in different hospitals, different areas of medical services. So Indian nurses are playing a vital role in the medical profession, medical world, medical industry of the world itself. So as we might be a small person or a student studying in a college or working in a hospital, but we have a vital role to play in our country as well as in the world. Wherever we are working, we have to grow our in our profession. We have to learn more, and we have to get into a position to the positions where we are playing a vital role in a hospital or in the industry itself, right? So we need to learn more and more, and we are moving to the next session. Before that, I would like to inform you about a little bit about the Easy Nurse, the organizing team, the platform which we are introducing before starting the next session with Ms. Ashwati Ashokan. Easy Nurse is a platform, an innovative learning platform which helps you to understand the different areas of nursing, different topics which comes across your learning path. And we have different kind of 3D animation models and simulation models which could help you to understand the topics and the learnings you need to have in your nursing journey. And sorry. So this platform will help you to understand and support you in your journey wherever you are, whichever state you are, and whichever country you are. You can access these learnings. There are video lessons and different questions you can take from the platform. You can before you are going to appear any examinations, and we will be conducting different live sessions on different topics also, so that facilities you can avail with a very minimal charges. And to move on, we have Ms. Ashwati Ashokan, as I had informed you. Ashwati Ashokan is a Chief Nursing Officer on Chiron Oncology from Bangalore. She has completed her MSc in nursing, and she's a PhD. She is pursuing her PhD as of now. So I would like to call upon Ms. Ashwati Ashokan to join with us. Ma'am, if you could switch on your video.
Yeah, thank you so much, Ajit sir, for the kind introduction. I have already turned on my video. I
Yeah,
hope.
you are visible. Yeah, now it's visible. Yeah.
Yeah, so a very warm good evening to one and all. And first of all, I'm very honored to have a talk in this webinar. First, I would like to thank the organizing committee of EZI app. And I feel that such sort of educative innovations are needed in nursing. So, and also I thank the audience or the nursing students or the early, I mean, the nurses who have joined the session. Without further ado, we will move on. So I think I'm not able to share my screen. Yeah, thank you so much.
Yeah, okay.
Yeah. Is it visible, ma'am?
Yes, ma'am, it's visible.
Okay. So today we are going to see the topic that lies at the very core of our nursing profession, that is communication skills for the future nurses. So let me begin by sharing.
Hello, ma'am. Ma'am, you are not audible now. Can you? You can share the screen again. First. Yeah, can you?
Yeah, am I audible, ma'am?
Yes, you're audible now.
Yeah, if my screen is visible?
No, ma'am. Can you share the screen again?
Yes, ma'am. Sorry. I'm really sorry. I think some network issues going on. I'm so sorry.
Oh, okay. Let's ma'am share the screen. Meanwhile, I would like to inform you one more thing. Like this is a certificate program. After this program, you will be getting certificates from our side, a certificate of participation. So by the end of this session, we will be sharing you a link to give your feedback about the program and share your suggestions on the programs. We will be coming with this kind of programs in future also. We will be coming with this kind of program in future also. So you can share your suggestions on that form, and whoever submits this feedback and the suggestion, those people will be getting the certificate. So please be with us in this session and continue with us. So after this session, we will be sharing the link for the feedback form in the chat box, which you can access and give your feedback and get the certificate, right? Thanks a lot. Ma'am, you can share the screen now. Are you able to share the screen now?
Okay. I think, yeah, sir. Sorry for the interruption. I know, like, I do know, like, network is continuously getting interrupted. Sorry for that. Yeah. Is my screen visible now?
Yes, ma'am. Yes, ma'am. It's visible now.
Okay. Yeah. So like I think I was missed, I mean interrupted in between. So like as I was mentioning, communication is a very essential skill, and it is a very core of our nursing profession. And here today in this webinar, we are going to see more about the communication, its importance in nursing. And instead of a simple, having a advanced medical knowledge or having a high technology with us. The nursing is all about a connection, emotional connect with the patient. And that's what exactly we will be exploring today. That's how communication, when done right, becomes the nurse's most powerful clinical tool. So I'm moving on to the critical connection, as I mentioned, the communication with the nursing practice. So as per the Joint Commission findings, shows that 80% of the medication errors are due to the poor communication in nursing, especially during the nursing handovers. And that is a huge risk that can be easily reduced with the better information exchange. Also, on another hand, if you're seeing a 95% of patient satisfaction is linked to the way which the nurses communicate. It's not just about what the nurses say, but how we listen, how we explain, the reassurance we are giving to the patient. So that's the trust starts with. And because the nurses are present 24/7 with the patient, we are constantly coordinating the care rather than the consultants or the doctors. So the communication is not just a task, but I think it is a precious thing which owns everything together, or everything we do in our patient-centric care. So if we want a better outcome, or if you want a better patient recovery, there should be fewer errors and there should be more satisfied patients. So it all starts with how we strengthen our communication. So why communication matters in nursing? It's really a good, thing we have to consider while we are in patient care. So communication is not just a part of nursing; it's nursing itself. So as I mentioned before, it helps us to build a trust with the patient, making them feel safe and heard. And it's how we can prevent our errors also by giving clear handovers, reporting the concerns, and the double checking the details during the handover process, which help us to reduce our errors. And even good documentation keeps everyone on the same page. If a nurse is taking care of a patient in the morning shift, and if the documentation is good, and if it is an effective documentation, it helps us, the next shift nurse, to handle the patient in a better way. And also with nursing is a profession where there are so many people are involved in the care of the patient. So team communication is also what keeps running everything smoothly. So whether you are talking to a patient, or you're writing a note, or you're collaborating with a doctor, or with a physiotherapist, or with a clinical pharmacologist, communication is the most powerful tool. So that's why communication is very important when it comes to nursing. So as nurses, every one of us, or nursing students, if you are going to the ward for your postings, we have seen that the nurses communicate in different ways than we realize, and every type of the communication matters when it comes to patients. So first one is a verbal communication. So verbal communication is the most obvious one. How we are speaking to the patient, explaining them about their care procedures, and how we are offering reassurance to the patient. But often it is our non-verbal communications or non-verbal cues like our eye contact, facial expression, even our silence that says the most. So a calm tone or a reassuring touch can build a trust faster than the words could say. And the next comes to that written out and the digital communication. So it starts from charting in the patient files or in the electronic health record system to update it. So it's how we document the care and connect with the interdisciplinary teams. And those communications should be very clear, accurate, and professional for our complete care. So in nursing, communication is not just about talking. It's about connecting with the patients in every other form. So that's about the types of communication. So while I'm talking about communication, I think therapeutic communication is the one which as a nurse or as nurses, we can't forget. So it goes beyond just a talking. It's a therapeutic communication means it's something related that we are making the patient feel safe, understood, and supported. So it starts with active listening. So when we're going to a patient side, not just like we are hearing, it should be like we are truly paying attention to what a patient says and what they don't say. So then there comes the importance of empathy and presence. So like showing the patient that we care for them and we are there with them, not just for them. So that's the real game where we are communicating in a therapeutic aspect with the patient. And finally comes a non-verbal cues. So non-verbal cues, as I mentioned earlier, it include eye contact, body language, and the tone often speak louder than the words. So as I said, a calm voice or a gentle gesture can more ease a patient anxiety than any other anti-anxietic medicines or analgesics. So I think as nurses, these are the very small things, but very important things that can build trust while starting a relationship with the patient or while caring the patient. So this trust act as a foundation for healing. So in the communication, the very important aspect when we are coming to a clinical scenario is the trust. So through communication is the first step, which first and the foundation step through which we can gain the trust of the patient. So it's very important to gaining the trust of the patient so that we can participate or we can involve them in their entire care journey. So then coming to educating and empowering the patient. So here also communication plays a lot. So if we are not providing proper sort of informations or not involving the patients in the care, literally the nursing care become challenging. And we used to say that, okay, this patient is irritated or this sort of patients are a bit tough to handle. But what as a nurse, I feel most of the time, it's about the communication. So patient education shouldn't be just about giving instructions. It's about making sure that they truly understand and feel confident while we are taking care of them. So it starts with simplifying the medical jargons or the difficult words to the patient. So I have seen some of the nurses will go and tell the patient that, so this medicine is for OD. So OD is the medical jargon which the nurses or which the medical professionals used to use. So once daily. So instead of that, you have to take this medicine once time in a day, or you can take this medicine after the food or after the breakfast. So just simplifying the medical jargons will help them instead of confusing the patients. Also, we can use visual and teach back technique. So you can see in my slide, I have projected an image where we will ask the patient to repeat what we have told them or spoken to them, so that we can double ensure that the message which we passed is clear. Also, we need to encourage them to give open-ended questions, not just do you understand, but instead of that, what questions do you have? Suppose we are explaining them about the medication. So instead of that, do you understand, or is it okay? Is it fine? Instead of that, what questions do you have? So that they will feel free to communicate more, and also they will feel informed, and they are more likely to follow through with the treatment and take care of their own the treatment journey. So empowering the patients really important. So empowered patients are really healthy patients. So they will also feel, okay, the nurses are involving me in each and everything or every decision. So we have to empower the patients through communication, especially through open-ended questions. So then moving to again, how communication plays an important role in interdisciplinary team. So in a healthcare setting, as I said, communication is not just an important tool, but it is life-saving, rightly saying means. So here I'm highlighting 3 pillars of effective communication. That is, first one is reporting. So reporting in the sense it is between the nursing team, or it between the nurses and the doctors or nurses with the clinical pharmacology, or nursing with the physiotherapy. So timely and accurate updates between the professionals ensure that everybody is understanding, or everybody is on the same page while it comes to patient care. So reporting is very important. We need to accurately report whatever happens in the shift or whatever happens with the patient. Then coming to the second pillar, that is collaboration. So true teamwork means it is leveraging each professional's expertise. So a nurse's observation, a doctor's decision, a pharmacist's input, they all matter. So team collaboration is very important. And I truly believe collaboration is not possible without a communication. So that says the importance of the second pillar. So coming to the last or the final pillar, that is the information sharing. So seamless exchange of patient data, lab results, and the care plans, it leads to faster, safer decisions. So as we see in this image, when professionals huddle together, or if they stand together, it's not just a routine where the lives are shaped through this shared conversations, or shared knowledge, or mutual respect. And also, I believe the people who are drawing on the slides, I mean, drawing throughout the presentation, they're trying to communicate something. It's an example that they are showing a way of communication. So, yeah, thank you. Moving to the next slide, that is the barriers and the solutions to the effective communication. So even I have seen many best teams, or the teams of doctors or nurses can stumble when communication breaks down. So we can see the 4 common barriers and how we can overcome that barriers. So first barrier is a language barrier, where we are often we can see it in the clinical area, because if we are getting an international patient who knows only Arabic, or the patient knows only certain language, we will feel difficult to communicate to the patient. But the care must be universal. We need to fix it at any cost. So in that, the best way to solve this is we can approach the professional interpreters, or we can use translation tools. I think most of the nurses started using Google translators, and even in my department, nurses used to use this Google translators while communicating to the patient, making the patient comfortable and engaged throughout the care. So that is how we can overcome the language barrier. Then coming to the next barrier, that is emotional distress. So if the patient, or if a nurse is under the stress, so we may not be able to communicate in both way. I mean, if we are stressed, we are not able to communicate, and the patient. So in that way, we can help by practicing a therapeutic communication and offering emotional support. So like it can be through, if you're not able to communicate orally, we can use non-verbal cues, or we can, if the patient we are seeing that struggling with the emotional dilemma, we can offer them emotional support. So that's how the second barrier can be sorted out. And coming to the third one, that is the information overload. So too much of data can drown out what's important. We need to prioritize our key messages, and we need to use certain tools like I think in the hospital side, may we have I mean you can see nurses use certain formats while they are taking handover, while they are reporting about a patient. So like that, we can avoid too much of information and we can stick on to only the needed information, so that we can prioritize what is needed. And the last one is the technological limitations. So as I said, fancy systems are useful only when we know how to use them. So the solution for this is we have to provide proper training on the new technology. I mean, if it started coming to the ward or to the hospital, suppose for an example, if a new electronic health record system is implemented in the hospital, or another digital platform is implemented, how we can, overcome the barrier is that we have to make a training program for the nurses in such a way that everyone is getting oriented to what we are introducing. So tackling these barriers helps us to heads on to the communication stays clear, compassionate, and connected, just like a good healthcare team to be. So as Dinesh sir said, the communication is a foundation for a leadership skill. So a good leader is the one who is very good in communication, as I believe. So as sir said, great leaders are not just good decision makers; they are powerful communicators. So let us see the 4 ways through which the communication shapes the leaderships in healthcare. So first one should be a leader should have a open and a clear communication. So if a person is having an open and a clear communication, it is considered as a leadership skill. So whether it can be a shift handover or a policy update, clarity always avoids confusion and it builds trust within the team and with the patient and the nurses. So coming next is the cultural sensitive communication. So as our team and the patients are always diverse, adapting how we speak shows a respect and makes the care more inclusive. So we should be always be very careful while we are having a communication with a diverse group of people. And active listening in communication is an essential leadership skill. So leadership is not only talking, it's about true listening. So when we listen with an intention, we can build a rapport with the patient or with the team. That rapport will help us to understand better about the personality, and we can lead more effectively. And the final the final skill is respectful feedback. So feedback should not be only the negative feedbacks or the feedback which hurts others. It should be done in a right way, because it should be a growth, tool for a growth, not only for criticism. So we remember as leaders or as healthcare professionals, we should remember every word we choose, every pause we take, every words we pick can make you just a team member, but a leader worth following. So communication is really as an essential leadership skill. So how to develop essential communication as future nurses or as nurses, already established nurses, we should know how to develop communication. So communication is not, good communication is not just we are born with, but it's something we practice and we polish. So even being great leaders, I have seen many people are struggling with the communication. They are not rightly communicating, whether it can be the communication about patients or it can be the communication within the team. So we have to practice, we have to pause. First of all, it's a role play. So through role play, we can rehearse a tough conversation. So before breaking a bad news or handling a conflict, we can rehearse ourselves. It can be a mirror, in front of a mirror, we can stand and we can see the way we are communicating, or we can practice even, it helps us in building our confidence. So next is a clinical simulation. So clinical simulation means real life scenarios in a safe environment. So it helps us to do a thing, a high risk thing without taking much risk. As our app is such a, we can take it as an example. So, the EZI app have created to bring such sort of help for the students, because it helps us in getting clinical simulations before we are really going to a patient side. So, clinical simulations we can do to develop a communication skill. And finally, a feedback session. So you have to take feedback after you communicate with, suppose you're a junior nurse working in a ward, so you can ask your senior nurse or a shift in charge, could you please give me a feedback about my communication with the patient? How can I be better, or how can I sharpen my communication skills? So these are the ways as nurses we can develop our essential communication skill. So these tools turn theory into action. So shaping not just how we talk, but it helps us to show how we and it is taking the major of the stakeholder in nursing or in the medical field. So, in today's space world, healthcare world, digital communication is becoming an essential in nursing as well as. So, first we can see what are the benefits it's bring to nursing. So, it helps us to have faster information exchange, remote patient monitoring, and smarter scheduling of our task. So, all thanks to the technology. So there are some examples of this sort of digital platform. So I would like to show you a digital platform which we are using in our current hospital setup. So it is a remote patient monitoring system which we are using in our hospital. So it helps us, the nurses, to sit in the nursing counter and monitor the patient's vitals. So these sort of digital technologies are popping up, which, as I said, it's a benefit for the nurses. Yeah. So, but as you know, there are so many other things like Microsoft Teams, Zoom, which we are currently using as a platform to communicate, electronic health reports, records. So these are the some of other examples of digital platforms in nursing. But as you know, we must also, while we are using this sort of technology, we should also be so much cautious about the data privacy and avoid miscommunication, and mostly important, we have to maintain that human connection or the kinesthetic touch, because no technology can replace a compassionate caring nurse. So, in a nutshell, I'm saying communication is not just a soft skill, it is a life saving one. So, when we communicate clearly, we heal better, we lead stronger, and we empower others to do the same. So, let's carry that forward in every shift, every interaction, and every decision you make. So, thank you so much for your time, and I think you can get back with your doubts or any queries you have. On to you, Ajit.
Yeah, thanks a lot, Ashwini ma'am. It was a wonderful session. I think every participant might have understood about the importance of communication when it comes to our profession. I think in my personal experience also, most of the patients whom I come across have used to tell about the relationship and the communication, the warmth we give to the patients during our experience or the time with the patients. So that's very important. We communicate professionally as well as empathetically to the patients we come across, not only with the patients but the people who we are working with, as well as the people around us. So it's very important. See, the communication is is as important as many soft skills or many skills we should develop during our professional growth. When it comes to our profession, the knowledge about the medical field is just the tip of the iceberg. I think we have to, along with the knowledge about knowledge about the topics we learn, with that we have to develop multiple skills which will help us, as well as the the customers or the patients we come across, to develop in our profession as a professional, or apart from that, in the healing process, as ma'am was sharing about, right? So thanks a lot, Ashwati ma'am. Ma'am is the Chief Nursing Officer of Sharon Oncology in Bangalore. Thank you, ma'am, for your wonderful session and your time also. And congratulations everyone who have participated in this sessions. I think you have got a very good understanding about the leadership qualities, how you can develop the leadership qualities, and what all the methods you can follow when you are becoming a leader in the medical profession, as well as the one of the most important soft skill you should have, which is the communication skill. And I would like to express my sincere gratitude to Dr. Dinesh Selvan sir, as well as Mr. Ashwati Ashokan ma'am, for being with us in this evening and helping us to understand these very, very important topics. And beyond that, I would like to inform you that in the chat box you can see the feedback form, which you can click on, and the link to the feedback form, you can click on that and give your feedbacks about the program and provide your suggestions about the program and the areas of improvements you can suggest. Definitely we will be coming with such programs to you, so that you can have wonderful the additions to your knowledge as well. And once again, the people who have joined on a later stage, I would like to tell you that the Easy Nurse application, the application which you can download from the Play Store as well as the App Store in the iOS platform, sorry, you can download it and use the application for your learnings, whether you are a BSc student or MSc student, or whether you are doing your GNM or post basic. You can download and you can get the video lessons and the 3D simulations, which will help you to understand the topics in a deeper manner and learn. And you will get multiple question papers also, which you can use for your examinations. And we will be coming with the live sessions, live training programs on the topics which you are studying also. That also you can access. So please provide your feedbacks about this session, as well as please give your suggestions, which all the areas you need more in-depth trainings, so that we can understand your requirements, and we can come up with more sessions like this or any other means. So thanks a lot for joining with us. You will be getting the certificate of completion on leadership and communication skills from Easy Nurse. Please provide your feedback and give your details so that we can send you the certificate. Thank you very much from the Easy Nurse team. Thank you, everyone. Over to the organizing team.
Okay, sir, thank you. I think we can wind up the session. Before that, students, please fill up the form that is given in the chat box. And there you can see the Google Play Store app link is there. So please join in our Easy Nurse application. Again, thanks to Ajit sir and our sir, Ashwati ma'am, and our sir to doing this session. Thank you again. Thank you so much, students. Thank you all. You can leave the session now. Thank you, Ajit sir.